Well, so far I have to say it's going quite well. The people are coming in great numbers and they are being treated. It is not the same like the first time that the people were in great numbers waiting, but right now the people are coming, they're being served, they're being checked and getting the diagnostic as soon as possible so that they can leave. This year also we have taken care about something to drink, and there are food facilities, there are different health programs like yoga, there are sports events that the children can do, there are the kids corner where the children can come and play when the family comes together. So it's a good thing that the family come out and enjoy themselves while getting their health checked out. One of the main projects of Lions Internationals is eye care. We will start testing first the elderly, and at the end of the year, around June, the school year, we will start testing the kindergarten, the students, the children that from kindergarten who are going to the primary school, to make sure that their eyes are checked prior that they go to school if they need any glasses or something like that. The need is big for these kind of health fairs, and we as St. Maarten Lions are very proud to be serving the community to make sure that we are a healthy community.
I'm Letty Peterson from the Diabetes Foundation of St. Maarten. I'm the president, but it is a group effort. All of us volunteers work together on a continuous basis. We have seen plenty of people. My guess is more than 300 people so far, and it is important for us to provide this service because diabetes is on the rise everywhere in the Caribbean, and St. Maarten is no different. It's growing by leaps and bounds, and that is why we do this actually every Saturday. We are somewhere in the community from 10 to 12. People come to get tested because the purpose for the Diabetes Foundation really is that we find people who might be diabetic through this testing program, because diabetes is an illness that doesn't always make people sick. So people, when they do get diagnosed with diabetes, sometimes a period of 10 to 12 years has already been passed. You see, and then they are faced with complications, and that is what we're trying to avoid. People who are obese because their lifestyle is not healthy, and it requires a healthy lifestyle to keep a body healthy, of course. And if you have it in the family, if you have the gene for it, then you're also at risk, because one of the questions on the questionnaire is always, do you know if in your family anybody has diabetes? And we ask a father, a mother, a brother, a sister, because that puts you more at risk, and therefore we advise you to screen on a regular basis.
Well, good afternoon to everyone. It's glad to have you here with us. My name is Charmaine Rowland, and I am representing St. Maarten Medical Center, to be more specific, the Intensive Care Unit, ICU as we all know it. And we are just here today to display some of the things that we experience at the ICU, and also to inform St. Martiners about the importance of CPR, that is cardiopulmonary resuscitation. And so far it's been going very well. CPR, it's something that some people think is just for healthcare professionals to get involved in, but as the years are progressing, people are realizing that it's also for the lay people to know, because sometimes you're faced with a situation where somebody is unresponsive or unconscious, and most likely that's a good case where CPR comes in. So it's good that we are informed and to know how to make early interventions to prevent deadly consequences for people. We've had hundreds of people come in. It's been going good, young and old. I was surprised even the little kids wants to be informed, and we've been having a good time with them. Yeah, so we demonstrated to them exactly what is done, and also we had some return demonstrations, and so far the return demonstrations has been very well. So that tells us that the education has been well received and also was well put into practice. Yeah? Thank you.
The Natural Health Club Foundation, we are into health prevention. So this chart that you see here, it's a chart where we explain how to prevent disease, all disease. As you can see on the chart, disease starts in the colon. The colon is dirty, your blood cell change from normal shape to a dirty shape at the bottom there. And eventually all diseases derive from that at a certain point in time. So we are explaining you why you get cancer and other diseases, because you're not cleansing, you're not purging. So the parasite that lives in your intestines, he multiplies. And after a while, too much of bacteria get into your bloodstream, and then all the cells start to get dysfunctional. So eventually, we are advising all folks to get on the program, do every 3 months a fasting cleansing diet of 10 days. And when you do this every 3 months, just like how you take your car to the garage to get a tune-up, you do the same at the same time. And that will help cleanse the bowel, alleviate all the toxins from your system, and eventually you prevent yourself from getting sick. And if you do go too far, there are ways and means you can get help by taking, for instance, a cold sit bath in a bath pan. You can take every day your olive and lemon, which I've been talking about for quite some time now. You take every morning a cup of bush tea, and you put a quarter of the yellow lemon with the skin in the tea, and you drink that. And that will help get rid of cholesterol, regulate your diabetes. It keeps away a lot of diseases. We are promoting also at this fair backyard gardening. So therefore we have 2 stands, one for health and one for backyard gardening, because we have to get the folks back into planting their own foods like what we used to do before. So it is very important that those persons willing to contact our foundation, the Natural Health Club, they can please get in contact with me. My name is Roseanne Rumnith. I'm the president, and my number is 526-5338. If they want a seminar or they would like us to explain them about health or about backyard gardening and farming, they can contact me at any time. So it's very important that the folks know that there is help, there is hope. Myself, I'm a cancer survivor. I got away from a stroke many years ago, and by being told about olive oil and lemon is why I'm doing it now for 20 years. But it naturally is something that is cheap. You can do it yourself, and we promote, therefore, self-help home remedies. So those are the things the old folks used to do before. What we now got lazy, I guess, and we don't want to purge and we don't want to cleanse, but actually, if we don't, we die very fast. Thank you.
It is indeed a very good thing to help you. You learn to respect and honor your body. You must maintain it as any vehicle. The stretching, the bending, the postures, and the breathing exercises that are controlled, you gain a flexible body, vibrant and healthy. So there's only benefits to get through this. A lot of illnesses too, like diabetes and arthritis, Parkinson's, a lot of things you can get help with your body through yoga.
What we're doing is trying to bring the awareness in having the children move a little more, get a little of that weight. They're all too overweight, so we're gonna try and get them attention to playing some tennis, skipping some rope, hula hoop, simple things that they can be busy with in the back of the yard, especially like skipping rope. Instead of buy a whole Nintendo, you buy a skipping rope for not even the half of the price, will be good, so that they can get away and be outside there and burn some energy. Social aspects of sports in the community, getting those kids together, let them socialize, play together, do things together, even with the parents, do things together. That is what we are looking at actually. All the children, the parents bring the children, drop them off and leave them there. So that is a little problem that we are having, why there's no control, there's no supervision. But what we would like to have the parents and the kids together in the different programs so they can interact and see what's going on, and that motivates the child much, much more to do something in sports, and then that both of them are aware of the health and what all can be done. Sports is actually the basic of your well-being, your health. You have to move. We don't walk as much as we used to. We jump in the car and we go where you gotta go and drop off and come back in the car. We have to have the kids them aware that, hey, you have 2 legs to walk, to move around, do certain things. Be aware that you need those heart, those intestines, heart, lungs, and everything has to be functioning. And if you're being carried back and forward, they don't function proper. And main thing is to, when you're doing all these sports and being active, make sure you drink a lot of water. All of us want to drink a lot of sodas and things like that, too much of sugar, and you're not moving, and that's where you stock up all that weight, and that makes it more difficult for your whole health and well-being. Yes? Thank you very, very much also. We should do this at least 2 to 3 times a year. You know, that would be very good.